Hello, I'm Dr. Arshnu from Dr. Arshnu's OIT Institute. In the series of the role plays, today's topic, which I've chosen, that is for the doctors, and the setting is local medical clinic. A doctor is seeing a 45 years old patient who had acute myocardial infarction, and he was admitted to the hospital with that. Now he's come to the clinic to get further information and recommendations for. In this case, doctors, you have to first greet the patient. As we know that we have three parts. First is introductory part. You have to introduce yourself. Then certain questions in the form of getting information from the patient. And the second part is information gathering regarding him. Third is to give the solutions or the information properly. Now let's start. The doctor, you should start. Good morning. My name is Dr. Dash and Dash, and I am your attending doctor today, or I'm the doctor in charge in the local medical clinic. How may I help? Tell that I was admitted to the hospital few days back, and I will discharged from the hospital after getting recovered from myocardial infarction or after having heart attack. Then this was the cause that the patient was admitted to hospital. Now you have to ask the patient certain questions. So the patient has come for the follow-up and to gather the proper information how he can manage at home. Your question could be regarding his lifestyle, his occupation, his food habits, his other habits like exercise, any interest he does, like he's doing gardening or something like that. And then it would be the cigarette smoking and alcohol consumption. You should ask the questions related to this. I'm giving you some example regarding that. You may ask that, can you please tell me what do you do for living? The patient will tell that I am working as a clerk and this is a sedentary lifestyle. I have to work for 10 hours. As a patient, concern is that he is feeling fatigued. Here you should ask the patient that, do you have any particular queries which you want to ask me? The patient will tell that, yes, doctor, I often feel tired after my discharge from the hospital or after the attack I had. And you have to ask the patient that for how long he has been suffering, because it is not now. He would be experiencing the same symptoms for the last couple of days or months. Then you should ask the patient about his food habits. 90% of patients with such condition have quality lifestyle, overworking timings, and secondly, their food is usually full of fats, sugar, and salt. It might be outside food. Then the third question, that the patient does not do any exercise. You have to ask the patient that what type of activities do you do? Or do you do any exercise? The patient will definitely tell you that, no, I don't have enough time to do exercise and I don't do any exercise. Then as you're asking patient, you have to ask the patient, if you don't mind, may I ask you some personal question? Do you consume alcohol? Patient will say, yes, I do consume alcohol. How many units? He will say that 3 to 4 units per day, or it might be 21 to 25 units per week. See, doctors, it's very, very important for you to gather the information properly, first of all. You may write all this information on a page, and after that, by seeing on this page, you can answer the questions. See, now the patient, we have covered all the things here, and now you have to explain the patient regarding the recommendations. First of all, you should tell that it's imperative for you to reduce your working hours. I can see that you're working over hourly. So this is crucial for you to reduce your working hours up to 6 hours only. Don't exert yourself overly. Then the patient has concern that he wants to know whether he is able to do any exercise, because he's feeling that if he does any exercise, it might lead to another heart attack. So that's the reason he's not doing any physical activity. You have to tell that you may start mild exercises. You should directly say that I don't suggest you for strenuous exercises, but you can start with yoga. You can do deep breathing exercises, which will be very beneficial for you. Secondly, you may start running, jogging, or walking, which is the best recommended exercises for you. Then come with the part alcohol consumption and smoking. It's crucial or it's imperative that the patient should be refrained from that. Strictly ask the patient to avoid drinking and to consume alcohol. You may be a bit liberal here to let him to consume 1 unit per day, or it may be 5 to 6 units per week. But he should immediately cessate smoking or quit smoking. Because the patient with the myocardial infarction, they are strictly prohibited for smoking. In this way, you can tell the patient, see doctors, first of all, when you are asking the questions, must write down the information you have gathered. Then you should rephrase all the information as I'm telling you that, Mr. Jack, as per our conversations, I have come to know that you're working as a clerk on a desk and it is sedentary job of yours. Second, you're taking most of the food from outside. Thirdly, you don't do any exercise, and now you're scared that any exercise may lead to another heart attack. You consume alcohol and you smoke 10 to 12 cigarettes per day. Am I all right? So, do you want to add some more information to that? Do you feel that I should know more than this? In this way, you rephrase all the information. Then you have to give the suggestion to the patient. In this way, this role will be completed, and we have 5 minutes to complete this task. Do not forget to ask the relevant questions to the patient. Don't ask irrelevant questions. Then you may give the suggestion, and at the end, you may say, I'm giving you a pamphlet which has a complete information regarding do's and don'ts. If you feel any problem like intense pain or you find any other problem, you can contact us with the emergency number to seek immediate medical aid. Hope this help you in preparing other topics also. I have prepared a complete video on lifestyle modification. You can see that video also. Now, at the end, it's important for you to give the information how the patient can contact in the emergency condition because he is scared of that. As I've already told that the emergency number is given on the pamphlet or in the discharge slip. You may tell the patient that you can contact that. So by this video, I'm feeling that this will be useful for you to prepare other topics on the lifestyle modifications. If you like this video, must like and share this video with our other friends also. If you have not subscribed our channel yet, subscribe it right now to get the latest updates on our channel. I'm an author of the book which is coming very soon in the market, that is Crack OET at First Attempt. You can pre-book your book at this time, because at this, if you pre-book your book, it will be cost you 50% discount. Thanks for watching. Stay healthy. Happy learning. See you very soon with the new video. Thanks for watching.